call the member for Clark.
Good evening, Deputy Speaker. Well, Deputy Speaker, the community obviously wants choice for older Australians. Older Australians want choice. They want to have the choice to grow old and even die at home. And we need to give them that choice. That's certainly what my community is saying to me, what older Australians are saying to me. It's my own lived experience. And if you excuse me, Deputy Speaker, for being a little indulgent and recounting my own family's circumstances, where first my father and then my mother, they both desperately wanted to grow old at home, and they both did grow old at home exactly as they wished. In fact, they both died in the family home as they wanted. So I certainly got to see firsthand the importance of giving people that choice and making it work. I would have thought too that politicians, my honourable colleagues, would see the sense in compassionate policies, and the bean counters would see the sense in keeping people at home as long as, or allowing people to stay at home as long as possible, if only to ease the pressure on the residential aged care system. So having said all that, Deputy Speaker, I find it unfathomable that governments haven't really been fair dinkum about funding home care adequately. I fear that in many ways a number of governments have paid lip service to it over the years, because how else to explain the fact that there are currently more people waiting for home care packages than there are people receiving home care packages. Clearly we are not taking it seriously enough. Clearly governments are not funding it adequately, and I think it goes back to really the whole funding model, Deputy Speaker. It should be demand-driven. It should not be budget-capped. It shouldn't be the case that someone who's waiting for a home care package literally has to wait for someone to go into residential aged care or to die. I mean, what sort of policy is that? What sort of funding model is that? That there are people waiting for other people to die before they can get the home care package they need to continue to live at home with dignity. As the member for Indi recounted, there are people who are being effectively forced into residential care because they can't get the home care they need. I mean, that's another reason why the residential care system is under so much pressure and performing so badly. So what governments need to do is get fair dinkum about this and fund it properly. And yes, by some estimates, it will cost maybe a couple of $1 billion extra a year to come up with the 100,000 or so extra home care packages. But surely we can afford that, Deputy Speaker. Surely it's all about priorities. At the risk of sounding like a broken record in this place, can I just remind my colleagues, can I remind the government, can I remind the minister, we're a fabulously wealthy country. We can afford to look after our very young with adequate early childhood education. We can afford to look after people with a disability properly. We can afford to look after people who are relying on the aged care, pension properly. We can afford to look after people properly in their home with home care packages. We can afford to look after properly people who go into residential aged care. By examining figures that have been already provided by the Federal Department of Health, I see that we might need $2.5 billion extra to go into home care packages to fill the very severe shortfall. Well, we are the 11th richest country in the world measured by GDP. We are the second wealthiest people on the planet when compared to median wealth per adult, second only to the Swiss. Surely if there's a country in the world that can get rid of this shocking situation where people are waiting years for a home care package, surely we're that one country in the world that can achieve that. And not only do we need to find the money to do this right, so that people genuinely have a choice, genuinely have the option of staying at home, being well looked after, living with dignity and staying out of residential aged care for as long as possible or perhaps forever. Not only do we need to look at that, we also need to look at the design within the system. I have been saying to governments for years that the way the service providers structure their fees for people benefiting from home care packages needs to be seriously looked at. It just beggars belief that it is not unusual for service providers to be taking 30, 40, 50%. I've even seen one example of 70% of the budget for that home care package has been stripped out in fees. I mean, this is just ridiculous. I can't explain it. There is no way to explain it. A cynical observer would say it's either mismanagement or inefficiency or gouging or I don't know what. But how on earth a home care service provider can routinely take half of the government's package cost in fees is just beyond bizarre. In fact, I'll give you one case study. I'll just use his first name, Les, a lovely fellow in my own electorate. He's being billed $483 a month for, quote, case management. What is case management? How does it cost $483 a month? I mean, at $40 an hour, what's that? 12 hours. I mean, that's just absurd. That's an hour on the majority of the working days of the week. And Les is being billed for 10 hours travel for service provider personnel in a 31-day month. And he lives in the middle of Hobart. Les lives in the middle of Hobart and the service provider is billing him, in other words, taking out of the government's package for 10 hours of travel a month. I mean, that needs to be looked at. Deputy Speaker, I've raised these issues with governments for years. I was assured by the government several years ago, that when home care packages went to consumer-directed care, that the market would work it out, that when consumers could choose their service providers for home care packages, that consumers would shop around and it would force service providers to become leaner, more efficient and to bring all of these management and other fees down. But, Deputy Speaker, it just hasn't happened. It hasn't happened. And frankly, I think we should have all known that this would be the case because, you know, a lot of people aren't able to shop around for 101 different reasons. Let's say you're a person of faith. You probably just default to a service provider of that faith. Nothing wrong with that. It's understandable, but it does tend to debunk the whole idea of consumers shopping around and forcing service providers to improve their service, lower their fees and for the consumer to be better off. It's a particular issue also, Deputy Speaker, in Tasmania, where much of Tasmania is what you might describe as a thin and regional market. You know, you have a small town, you might be lucky to have one service provider. You're not going to shop around. The service provider has a monopoly. They'll charge 50, 60, 70% in fees. You know, chances are you might have someone on a package of $50,000. The service provider pockets $25,000. For whatever reason, the consumer doesn't have access to everything they might need or want, or even be aware of it. They might end up buying $15,000 of home care effectively out of a $50,000 package. That's an extreme example, but it's not an unbelievable example. So, frankly, Deputy Speaker, I think the whole idea of consumer-directed care fixing problems in the industry, and it is an industry, I think it's proven to be misplaced. And, Deputy Speaker, I'll tell you something else I learnt from my own lived experience with my mum and dad growing old and dying at home, and their wishes being fulfilled. They both were in receipt of home care packages, and they were very grateful for those home care packages. They were lucky to have home care packages. They didn't have to wait years like some consumers do. But they were ultimately only able to grow old at home like they wanted because my sister, a nurse, gave up nursing for a decade to be their carer. And as we talk about home care packages, I think we need to be also talking about carers because, let's face it, home care packages can't meet all of the needs. And often carers who are most often family members, giving up their livelihoods, their profession, their social life. They're staying at home and they're helping out with their mum or dad or brother or sister or son and daughter. So I got to see firsthand how a very talented senior nurse gave up nursing for a decade which was obviously to the detriment of the community, that person wasn't able to, to work at Tamworth-based hospital in this case. But it also meant that person didn't have a regular income for a decade, couldn't accumulate super for a decade, and lived on quite a paltry carer's payment. I think as a country, Deputy Speaker, we should have a different approach to carers. I don't think we should see them as people on welfare from Centrelink. I think we should see them as public servants or members of the community doing a genuine public service. I don't even think Centrelink should pay carers. I think they should be paid what we might characterise as a wage, have access to necessary things like workers' compensation, and even be paid super. Now that's a fairly bold idea, but I think that would elevate carers to their correct position or correct status in all this. They're not people on welfare. They are people who are working, and they're saving the government a fortune. They're saving the government billions of dollars, and they're ensuring too that the loved one in care is in the most loving environment and not stuck in some ordinary residential aged care facility where the long-suffering staff, overworked and underpaid staff, might have 10 minutes or 8 minutes in the morning to get the resident sorted, help them wash, have their breakfast and whatnot. I mean, carers, I think they are one of the unsung heroes of the country, and they're actually a critical component of the home care system, and I think we should treat them as such. They save the government a fortune. Why don't we compensate them a little better? I think if we did nothing else, Deputy Speaker, let's pay them super. I think that'd be a really positive start. And let's not forget there's a gender dimension to this. Those carers are most often females who are already behind the 8 ball when it comes to their professional development and progression and their super balance. There's another reason to look carefully at this. So, Deputy Speaker, I'll finish my comments here. I think we're almost out of time anyway. I'm getting the wound up here by the Speaker.
No, you're getting the encouragement to keep going.
Oh, no, you want me to keep going? Because that's called a filibuster.
We're so enthralled, we'd like you to speak to 7:30 if you can.
I could talk about what I did on my holidays. But all jokes aside, this is a desperately serious matter. The fact is that we are very short of home care packages, and the government needs to find the money to meet that need. It's not a case of 6,000 more packages one month and 20 more thousand packages, at another time, because we're just putting band-aids on a problem. We need 100,000. We need a funding, or an approach to funding which is demand-driven, and we as politicians, as leaders in the community, need to be able to look our older Australians in the eye and say, we guarantee that we will look after you as you age. We guarantee that if you choose to live at home, that you'll get all the support you need, and you'll get it within months of applying. And we guarantee that if you decide to or need to go into residential care, that residential care facility will be world's best practice, absolutely first class. It will be safe, it will be comfortable, it will be loving. Your meals will be just like you used to get at home. We can afford to do all this, Speaker. We are a fabulously rich country. It's all about priorities. We seem to have thousands of priorities, but what really matters? I would have said it's our very young, our very old, people with a disability, disadvantaged members of the community. I think that's what really matters. All of us, we can all look after ourselves. But there's an awful lot of people out there who need help from us, and it's our duty to help them. And I'm now 7 seconds, Speaker. I think I've made it. But I'm very grateful for the extra time because this is such an important issue. Thank you, Speaker.
I thank the member for